I'm Dr. Abha Mahashu, consultant pulmonologist at Leelavati Hospital and Research Center. Awareness regarding tuberculosis is a very important concern for all of us. First, we need to know that why do we need this awareness against tuberculosis? So, awareness regarding any concern is directly related to the magnitude of the problem and to certain part that if we can do something about it. So, for tuberculosis, we need to know that globally, 1.3 million people lost their lives in 2022 because of tuberculosis. If we talk about India, we have the maximum burden of the disease, wherein 2 people die in every 3 minutes because of tuberculosis. We all were so stressed, we all went through a bad turmoil because of the COVID pandemic. So many lives were lost. But do we know that tuberculosis is the second most common disease amongst the infectious diseases after COVID, which can lead to death for our people around? And if we take proper care, if we treat these patients timely, we can cure this problem. Now let us understand what is tuberculosis. Tuberculosis is an infectious disease which is caused by a bacilli called Mycobacterium tuberculosis. Approximately, if we see the statistics, 1/4 of our world is right now infected with this organism. But does everyone have disease? Answer is no. Around 5 to 10% of this population which is infected eventually develops symptom and disease, and that is where the spread happens. But it is extremely important to understand that both the infected state and the disease states are the current concern for us. Now, if we know that the tuberculosis being an infectious disease can be treated by antibiotics by a prescribed TB expert, which should be taken very religiously over a period of few months as prescribed to you. Coming to the common symptoms, so tuberculosis commonly presents as a prolonged cough, typically more than 2 weeks, with or without phlegm. You can have blood in your phlegm that should raise an alarm. People can have fever for more than 2 weeks, typically low-grade evening rise is what they explain. They can have unexplained weight loss, extreme weakness and fatigue, night sweats. Now these are all called constitutional symptoms as well. The symptoms of tuberculosis depend upon the organ involved by the disease. So for example, if you have an involvement of lymph node, you may have, along with these constitutional symptoms, swelling or lump in that area. You can feel a restriction of movement because of that lump which has developed. There can be many other organs which are involved, not only lung, but yes, lung is the most commonly involved organ. Other organs would be like kidney, brain, spine, lymph nodes, pleura, all of them can be involved and have to be treated with equal concern. Now coming to the fact that what are the risk factors for tuberculosis? When we talk about risk factors, they are the disease conditions or states which predisposes one to develop TB disease or which makes this disease to go towards much severe forms which are difficult to handle. Now, namely, in case of TB, diabetes is the first thing which comes to our mind because it's a dangerous state for tuberculosis, and this has a both sideways difficult problem. If you have a bad form of diabetes, you must screen for tuberculosis. If you have a bad form of tuberculosis or especially a resistant tuberculosis, you must screen for diabetes. Treating both of them are not only important for their own control, but also for the other side of the disease to be controlled in a better way. Second is HIV, which is an immunocompromised state, which definitely makes the chances of one to go towards a disease state of tuberculosis much, much higher. Also, it leads to a severe form of TB if not treated well. Thirdly, undernourished states. So it's not only about the tuberculosis treatment, but also we have to take a lot of care of nutrition. So if you are undernourished, you are going to get bad form of disease. If you are undernourished, then the healing power also reduces for the body. Fourthly, if you are consuming alcohol in a considerable amount, yes, it is a risk factor. And lastly, if you are having tobacco use, definitely we are in a bigger problem. Let's come towards what is the difference between the infected state with tuberculosis and diseased state of tuberculosis. It is something which is of concern these days, so we should not get confused. If you are infected with tuberculosis, you may not get sick, you will not have any symptoms, and you will not be spreading the disease to others. So this bacilli has a wonderful property of staying dormant in our body for years together. Now coming to the diseased state, if you have disease, you are bound to have symptoms. You will be spreading the disease to others. So you must treat yourself as soon as possible. Now, we must know that how this disease spreads in community. If one person who has the active form of tuberculosis coughs, sneezes, speaks, then these bacilli are suspended in the environment in droplet form. And these droplets, when are inhaled by people around you, then they get deposited into the lung where the seedlings happen, and with the help of blood circulation, they may reach to rest of the organs of the body, which can be infected. So, some myths have to be broken here. Shaking hands does not spread tuberculosis. Sharing linen does not spread tuberculosis. Sharing clothes does not spread anything like tuberculosis. So we should not have any kind of unnecessary fear around the disease. Now coming to how can we prevent this disease? The most important question for us is, if we can prevent, can we reduce the burden? Of course, yes. The problem with tuberculosis is not only the scare of the disease, there is a lot of cost implication, there is a long duration of treatment, there are side effects. So if we can just prevent to get into that vicious cycle, something definitely would be better for us. How can we do that? So the responsibility largely depends upon the individual. If you feel that you have any of the symptoms which I have just explained to you, please reach out to the doctor nearby immediately and rule out tuberculosis. Doing so will not only help you to detect early, treat yourself early, reduce the duration of recovery for you, but will also reduce the spread of disease in community. Secondly, household contacts like family members and those who are immunocompromised like HIV patients must screen themselves for infection of tuberculosis as well. Thirdly, if you are given treatment either for infection or for disease, you must take it religiously for the stated duration, because this will lead to reduced spread around in the community. Lastly, following cough hygiene when you are infected is extremely important. Please take care of your soil tissue if you have, and if you're sneezing around, please dispose them properly. If you know that you have an active disease, do not go to public places until you discuss with your doctor that if I'm okay to go to mingle with people around or no. Usually we say that 4 to 6 weeks is the time duration, but again, every individual is different. Lastly, drug-resistant tuberculosis, is it something where we have to be worried? Answer to this question would be yes. Drug-resistant tuberculosis is a state where you get a tuberculosis with a germ which is resistant to most of the common antibiotics which we treat our patients with. So, you are treated with a much more number of drugs, with much more side effects. Maybe injectables are required at times for these patients. Cost of these medications are also high, but at the end of everything, it can be treated and you can be cured from this part of tuberculosis as well. So, I don't think that there is anything to get scared. Taking the stress of treating is much less than the stress of not treating. So, let's treat TB and stay healthy. Thank you.